know that our best chance of beating the cancer, the best chance of the patient living to the ripe old age, is to apply the right treatments to the right patients. And applying the right treatments is primarily a matter of understanding the biology of the cancer, understanding what drives the growth of the cancer, what makes that cancer the cancer that it is.
Breast cancer is a disease of the whole body. It's not the disease of the breast. If we don't use medications that go everywhere in the body, we're very likely to miss the important part of breast cancer.
Medical treatments are given systemically, which just means that they're given into the bloodstream and they treat the cancer wherever it may be in the body. Really one of the most important things that we do at the time of initial diagnosis is to do a careful examination of the tumor. This is performed by our breast pathologist. We're really interested in what we refer to as the subtype of the breast cancer. We really define these subsets of breast cancer by three major markers. One is called the estrogen receptor, or ER. The second one is the progesterone receptor, PR. And the third is a protein called HER2. You can have any combination of markers. So some tumors are positive for all three markers, the ER, the PR, the HER2. Some are negative for all three. That's a triple negative breast cancer.
Systemic therapy is done in 3 settings in breast cancer. Remember that in most cases, the primary treatment of breast cancer is surgery. Sometimes we give before surgery with the aim of shrinking the tumor before the surgeon goes in and takes it out, and that can make the removal easier and can lead to a better cosmetic result. We often use systemic therapy after the surgery to try and kill any cells that may have been planted in the rest of the body, to stop them from growing and to let the body take over and get rid of them. The third setting we use systemic treatment is if the cancer returns and we're trying to reduce symptoms.
Cancers are the original teenage juvenile delinquent, always eating, always growing, and always getting into trouble. So the chemotherapy drugs that we use are designed to affect, or in particular kill, those rapidly dividing cancer cells.
And for every patient, we really have to take a personalized approach. We have to look at factors like the subtype of the breast cancer, focusing in on that ER, PR, and HER2 marker. But also we look at things like the stage of the cancer. How large was the tumor in the breast? Are the lymph nodes involved? How aggressive is the cancer? And all of these things help us to come up with a treatment plan most appropriate for that patient and her situation.
Currently, doctors who treat breast cancer use numerous systemic therapies. These include chemotherapies, drugs that kill dividing cancer cells, hormonal therapies, drugs that block estrogen, and HER2-targeted therapies, therapies that attack a particular growth factor for breast cancer.
So a lot of patients who are coming for their medical oncology consultation and getting recommendations for hormonal therapy, chemotherapy, and these types of things are definitely concerned about side effects and how these treatments will affect their day-to-day life, their ability to work, their ability to carry out their normal activities at home with their family. We definitely take a lot of care to think about and be proactive in managing side effects of treatment, and I think we're really quite effective at doing that. For hormonal therapy, overall, these are very well tolerated drugs. They really don't cause any problems in terms of hair loss. There's no routine blood monitoring that's needed for blood counts, kidney function, or liver function. They can cause some symptomatic side effects like hot flashes, some vaginal dryness, sometimes some joint aches. But overall, we're always following up with our patients, trying to troubleshoot any problems they may be having, and can make modifications to the treatment plan depending on tolerance. In terms of chemotherapy, there's, again, a lot of concern and fear that patients have about chemotherapy and side effects of chemotherapy, but it's important to understand that there are many different types of chemotherapy, so the type of drug matters, the dose, the schedule, all of these things matter. Some treatments may cause hair loss, but many do not, and so it's important to ask your doctor about hair loss and things like that, and whether that is to be expected with your particular chemotherapy program. Nausea and vomiting can be seen with some drugs, not all. Again, there's a very proactive approach that's taken in terms of trying to give preventative medicines before administration of chemotherapy to prevent those complications. Chemotherapy can have effects on the bone marrow, and so the bone marrow is where we make our red cells and white cells and platelets, and so these counts can sometimes go down with chemotherapy. We routinely will give boosters to boost the white blood cell count to prevent any complications related to fever and infection, and those are really quite effective. The red blood cells can go down, but it's quite uncommon to need a blood transfusion. And so I think that overall those things are something that we can definitely manage well. Some drugs may have risks for infusion reactions, and so itching or other reactions during the infusion, and we take steps to try to prevent that. And still other drugs may have some effects on the nerve and can be associated with some numbness and tingling. For many patients, the diagnosis of breast cancer is a very, very difficult diagnosis for both themselves and their family. It feels like your life has just been taken and turned upside down. And certainly when we're talking about all of these different treatments, from radiation to surgery, now chemotherapy and hormone therapy, it can definitely feel overwhelming and scary. And our job is to try to educate, to guide our patients as they go through this process, to make ourselves available for any questions, and to have access to our entire team. So these are all people that you'll get to know and can help to guide you in terms of questions that may come up during the course of your treatment, specifically related to your systemic or medical therapies, but also to larger questions in terms of your overall treatment plan. And so we're happy to be available and very pleased that you've chosen to get your care with us.